Weight loss injections are not just about shedding pounds. They're a double-edged sword that comes with serious risks. And this isn't just about shedding pounds, it's about health. Research shows that both starting and stopping these medications can be dangerous, and Dr. Roberts, D.C., a leading expert in this field, is on the front lines helping patients navigate the challenges. He's seen firsthand how these injections can cause severe side effects, even when used for short periods. One case involved a 16-year-old girl who developed excruciating pain and abdominal distress after stopping semaglutide, a common GLP-1 agonist. Her symptoms persisted for 6 months before she returned to her doctor, where she eventually regained weight within weeks. While she lost no weight during the ordeal, her experience highlights the unpredictable nature of these treatments. Some patients face more severe or prolonged issues, such as life-threatening reactions reported by the FDA, which linked 162 deaths to these injections over the past 6 months. The number of deaths rose by 40% in the last 6 months, underscoring the gravity of the situation. Dr. Roberts emphasizes that while the risk of death is low compared to many common medications, it's still a critical concern. This underscores the inherent risks of any medication, and patients must weigh the pros and cons carefully. A 1997 study found that doctors often failed to inform patients about these risks, which is why Dr. Roberts urges patients to take responsibility for their own health. The semaglutide label lists potential side effects like pancreatitis, thyroid tumors, and even sudden vision loss, but recent studies have uncovered even more concerning issues. For example, a 2024 study found that up to 60% of weight loss on liraglutide resulted in muscle loss, which can slow metabolism and worsen physical function. Another 2025 study linked a threefold increase in non-arteritic anterior ischemic optic neuropathy, a sudden vision loss condition. Meanwhile, Medscape reports that FAERS data shows a rise in symptoms like anosmia, dysgeusia, and gastroesophageal reflux disease. Stopping these injections can lead to weight regain. As shown by a 2024 study, your 327 participants regained 2/3 of their weight within a year. Research also indicates that regained weight often carries a higher fat-to-muscle ratio, slowing metabolism and worsening metabolic health. Dr. Roberts warns that patients must understand this near-certain outcome to avoid regaining weight. Instead of viewing these injections as a shortcut to health, he advises treating them as a starting point for long-term wellness. To maintain weight loss, patients must address underlying issues like depression, gut bacteria imbalances, or insulin resistance. At Health Utah, patients undergo a comprehensive scan and questionnaire to identify these factors, ensuring personalized care. The final step involves creating a sustainable food plan tailored to individual needs. Dr. Roberts explains that while injections reduce calorie intake, they ultimately fail because they lower calorie consumption, which doesn't work long-term. Health Utah avoids calorie counting and focuses on holistic nutrition. They offer a $59 package for 2 people, including tests, reports, and consultations with Dr. Roberts. For those considering stopping injections, the risk of weight regain is real, but proactive steps can help manage it. The article highlights the importance of support systems, as a British study found that partners significantly improve weight loss success. Health Utah's approach combines medical expertise with personalized care, making it a unique solution for those seeking long-term weight management. However, the debate over the safety of these injections remains unresolved, with some arguing that the risks are justified, while others question whether the benefits outweigh the dangers. As with any treatment, transparency and informed decision-making are key. Always consult a healthcare provider before starting or stopping these injections.